root cause.
Piecemeal.
We do know the root cause. We already know the root cause. So what are we trying to identify? You've just indicated that there are people who are coming into the country illegally. Even their own governments are not able to identify them. When they're here illegally, they end up using our services because our laws and our constitution allow for that. Isn't that where the issue is? So when you say let's identify it, what do you mean?
No, look, I don't think that could be one. Look, firstly, the fact that they entered the country illegally, they committed a crime in the country. Do you agree with me?
Yes,
so meaning
I do.
Yes, meaning that the law enforcement agencies must enforce the law and act without a bias. So they need to enforce the law and arrest anyone. So they committed the crime. So they must be arrested and deported. So hence we say, Clement, if you know that your neighbor Foster is here, or you suspect that Foster, your neighbor, is here in the country illegally, what stops you from calling the law enforcement agency? What stops you from calling the immigration officers to come and interrogate Foster? And if I cannot provide any proof that I'm here in the country legally, then I must be deported.
Yeah, and Foster, I mean, you know how the system in this country is. I bet you there are many people who have probably tried that approach before. And part of the problem, which Home Affairs has admitted to, is the corruption in the system. So yes, you call that immigration officer, but they get given money and they walk away and nothing really happens. And look, I'm not trying to hold you accountable here for issue of our porous borders. Yes. That's not your department. You are the health department. But I'm trying to indicate that as government, you have completely failed to manage the borders, because now we're sitting with a situation where citizens are frustrated because they are unable, some of them, to get healthcare services because our healthcare system is overburdened by illegal immigrants. And all we're hearing is, oh, we need to go fix our borders, which is a promise that's been made for so long. So that's going to make it difficult for you then to have conversations with citizens who are frustrated, because they'll say to you, you've been promising to fix this and you're still not fixing it.
No, definitely. And just to give an example to say this is a societal issue. Look, someone can also argue that their children are not able to get the space in the local schools because now they have to compete with the children of undocumented foreign parents. So that is, hence I say this is a societal issue that must be dealt with holistically, not in a piecemeal. Exactly, you have pointed one of the contributing factors, the issue of corruption. So if we can try to address the issue of corruption and other contributing factors, definitely this issue will be able to address this issue once and for all.
Is there an expectation that when you are a foreign national or you are here illegally, there's supposed to be some payment of sorts that you have to make when you are getting health care, even in public hospitals? Can you clarify that for us? Because part of what we're hearing being reported is that this group sometimes wants to ensure, I don't know how they go about ensuring that, that there's some form of payment that's made at these clinics or these hospitals when it's foreign nationals that are consulting.
Yeah, no, according to the public health system in the country, the healthcare service at the primary level, meaning that at the clinic and community healthcare, is free of charge for anyone, regardless of their regardless of their migration status. Then at the higher level, the hospital level, it is not free for anyone, whether South Africans or whether foreign nationals, except for the following categories: pensioners, number one, number two, pregnant women, number three, children under the age of 5. So it's free for those 3 categories, but anyone is supposed to pay, and the cost is determined by what we call the means test. So your affordability, we check your affordability, then we're able to charge the price. But you know that in the public health sector, our priority is to save lives, unlike in private sector, where before they can even open a file, you need to put money, you need to show any form of a financial commitment that will be able to afford the healthcare. But in public health sector, we prioritize your health. Then we can sort out the issue of settling the bill afterwards. And that's where we find that some of these people are unable to afford not only foreign nationals, but also South Africans because of the level of unemployment.
Yeah. All right. Foster Mohale, let me thank you.